morning, everyone. I just want to say thank you for supporting me so far this month in May. I just wanted to touch bases with you guys. I looked back on my videos and I realized there were a couple of things that I didn't elaborate on as far as the symptoms, the treatment, even the prognosis of this disease. And so I just wanted to give some, quick information about that. When I was initially asked what are the symptoms of polymyositis, I just gave the general Google, answer, which is general tiredness, fatigue, muscle weakness, difficulty standing from a seated position, things like that. But to give you a personal view or insight of how your body actually feels, it's like when you're coming out of the swimming pool for a long time, or the beach, or wherever, when you go swimming and when you get out of the water initially, how heavy you feel. That's the heaviness. That's what they mean by extreme fatigue. You feel so heavy that you can't move. So that's the best way I can describe that feeling. It's like getting out of the swimming pool, and that initial heaviness that you feel that constantly. That's a daily feel when you're first, being diagnosed with this disease, because your count is so high. You don't feel like that when you're in the stage that I'm in. Yes, you still feel fatigue, but it's not that general heaviness that I felt when I was initially being diagnosed. Another thing that they said was the tightness that you could feel in your muscles. And the best way I could describe that is like when you're done lifting weights and the next day, the soreness that you feel in your muscles after lifting weights. That's pretty much how sore your body feels on a daily basis when first being diagnosed with it, when your count is so high. And it feels like at any moment you're going to pull a muscle. Excuse me. So I just wanted to kind of give you a better description that you could feel, personally, that you could understand more. Also, a sign to look for when your body is slowly starting to shut down. It's kind of like, how they say you don't think about your heart beating, it just beats. Well, we don't think about how we walk either. We just walk. We never concentrate on our steps. And one of the signs that a lot of people miss when they're first diagnosed is how their body tends to adjust and start to walk for their range of normal at that time. And the best way I can describe it, I went from, walking normal, never having to think about it. And the next thing I know, it's like I had to tell my brain, leg, move, lift, just something that you have to think about. And the best way I could describe that is how, if you've ever seen a horse walk, and he kind of, does like this little, I don't want to say trot, but I think that's the word for it, but how the horse leg pops like that, you will slowly start to notice that your legs are walking like that and not with a smooth flow. It's not, it's not your normal walk. Now you're forcing yourself to walk, and it's kind of like a high step because you're thinking about moving your legs. So that's the best way I could describe the way your body feels. That initial heaviness feels like you're getting out of a swimming pool. That soreness you feel is like the day after you get done lifting weights. And the sign you should look for is how your walk is starting to change. So I just wanted to touch base on that. The testing, I know I talked about one test, which is, the blood work that you would get done, which would be for your CK or CPK count, which I also informed you that it should be under 200 to be normal. Or for me, since being diagnosed, they call it remission. So you would get that. Some doctors order MRIs, so you also have that as well. And then the electromyography. Whew, y'all, that test is not fun. The doctors tell you it's like acupuncture. This long needle, it's like acupuncture. We're just going to stick it into your skin, and then it's going to pierce your muscle, and we're going to send electric shocks through it, and yeah, it hurts. You're gonna faint just from looking at the needle. And it's not like acupuncture at all. So, yeah, I mean, I guess they feel like it has to be done, but I don't think it has to be done because the muscle biopsy will confirm everything, which I had that done as well. So I've had the blood work, the MRI, the electromyography test, and I've had the muscle biopsy. So I think, you know, doctors, they want to cover all bases. They always want to run as many tests as possible. But I'm not going to lie to you. The electromyography test, I hated it. And I'm not a fan of needles. And when I see a needle this long, and you telling me it's going to go in my muscle, like in my leg, and you're going to send things to it and shock it and stuff, no. And I'm so glad my mom was there because she shut them down. She said, y'all going to take that needle out of my baby. We done. We not doing that no more. So, shout out to my mom. Mother's Day coming up. Also, treatments involve taking steroids. Unfortunately, that's just something that you're gonna have to take to get your body back in order. Their drug of choice for me was prednisone, and it's horrible. It changes your whole body. You know, you see a lot of people with the moon face, which I had, and you can tell, yeah, she's on prednisone. But yeah, it changes everything from your face, your body, everything. And also, in conjunction with the prednisone or any corticosteroid, they're going to give you a sparing agent, which is something like methotrexate or azathioprine. I take azathioprine. I've taken methotrexate in the past, but I got off of it when I became pregnant with my firstborn. And here comes my 3-year-old. So let me hurry up and try to wrap this video up. The other treatments, of course, are the physical therapies, because like I said, you have to move. If you don't move, you're not going to make it. Just point blank period. You don't move, you won't make it. So you have to do physical therapy, respiratory therapy, occupational therapy, and I loved water aerobics. I really did. That's one of the best ones because you don't feel any pain as you do with, you know, with your general physical therapy. Kynsley. Okay. So physical therapy can range from a simple 5-minute walk a day to a full-out workout. Whatever you can do at that stage of the polymyositis. Respiratory therapy. Let me show you guys. A lot of women know what this is. You use, especially if you had a C-section, you use this to help with your lungs. I do this daily, try to get my numbers up, and I use this. I use this to breathe through. Let me do an example. Hopefully I won't start coughing, but what that does is it rattles my lungs and try to remove as much phlegm, mucus, you know, all that good stuff as much as it can to help me breathe better. Here. And so, no, don't blow in it. And then I also use this. This actually goes inside my mouth, and I take deep breaths in, hold 2 to 5 seconds as long as I can. I don't have much reserve in my lungs anymore, but I put this in my mouth. I breathe in, breathe out, and what it does is it works the muscle tissue around my lungs. Now, the other big question that I don't like to talk about, that I did get asked about, was, can you die from polymyositis? And the answer is really yes and no. The reason why I say no is because if polymyositis was just by itself, no, because it's just the inflammation. However, since it does target your lungs and eventually your heart, then yes, you can die from it, because you develop ILD, which I spoke about that before, interstitial lung disease, which is scarring of the lungs. Once your lungs are scarred, there's no coming back from it. So therefore, eventually, you would have to get a lung transplant. Now, if you get pneumonia or the flu or any kind of bad respiratory infection, before, and you might be in the stage of getting a transplant, then yeah, you possibly could die from it. People die from pneumonia all the time and flu. But since my lungs are more jeopardized, or anybody's lungs that have ILD, you're at a higher risk. So I try to be very careful during the winter months. But yeah, my treatment for ILD right now and pulmonary hypertension is being on oxygen, because your body has to have enough oxygen to survive, and my stats without oxygen are not above a 95%. I just checked it right now. I'm fine, because I just had it on. But once I get to moving around throughout the day, I will have to put it back on, because usually my stats drop down into the 80s. So therefore, I have to wear the oxygen when I'm moving around. But either way it goes, I kind of feel like I'm breathing in and out. My breaths are very shallow. For a normal person, one breath for them, or for you, one breath for you is about 2 to 3 breaths for me. So every time you take one breath, I've already taken 2 minimum. So yeah, you can die from this disease because of the ILD, which leads to pulmonary hypertension, because your heart has to pump and work harder to get that oxygen through your body. And eventually, if you don't get that lung transplant, or the medication doesn't work, because I am on heart medication, the heart medication is no longer doing its job or able to do its job along with everything else, then yeah, you can. But like I always say, if you have no faith, you're dead anyway. That's just how I feel. And if I offended somebody, sorry, not sorry, because that's how I feel. That's my opinion. And let's see. I wanted to do a mother's video. Then I got to thinking, the way my children are set up might not be such a smart idea.